we do an academically course with sincerity, follow the live classes, even though there's a time difference, our classes are scheduled in a way that you're able to attend from Australia as well. You can easily clear.
Yes,
Right?
true. I think revision is the key. So whatever sources we're following, we should stick to it. And then definitely we have to focus a bit on recalls or the recent trend that is going on.
Did your clinical experience somewhere help in clearing this exam?
Definitely it helped in clearing. I was exposed to only one subject. So the remaining subjects I had to refer here only.
What was your strategy? How did you attempt the question paper while you were in there?
Total 150 questions. I just wrote down 50, 50, 50. And people used to say, do the first 50 question in 60 minutes and all that. So I just wrote down the timing, like 60 minutes, next 120, 130 minutes, and 210 minutes to finish this.
Good afternoon, everyone. I'm Dr. Ssnegdha Sharma, Academic Head Medical Sciences from Academic. Today is 3rd of October, and we got results for AMC September session. With us, we have Dr. Disha, who cleared her exams, and we congratulate her today. Dr. Disha, congratulations on clearing AMC Part 1. How does it feel?
Thank you so much, ma'am. I feel very good actually. Like all our efforts and the effort put in by academically is also rewarded, I feel.
Thank you so much. We are happy that we were part of your journey. It's not an easy road. But that was very quick. Like, you joined in March and then just quickly cleared in September. Like, I just want to know, were you working in India before you went to Australia?
Yes, I was working in India up till November, and then after that I took a gap. Like, here I'm not working. But then quick, because when I was attending the course and all, like ma'ams used to tell, when you're in the momentum, give it in that time itself. So the longer you stay, what happens is we tend to forget, or we might miss the concepts. So that's why just go with the momentum and give it.
And that's a very good advice for students who actually want to just finish it quickly, like start the course, do it and give it.
Yes.
So
true.
were you able to attend all the live classes, or how did it go with you, like considering there's a time difference?
No, time difference didn't matter much. So it was just 4 hours difference. But then, yes, I could attend all the classes, and I made sure I attended the classes. And after that, I went through the notes also. So what I can say is theory, for me, I got all these different subjects. I got it through academically itself. For theory, I did not refer anywhere else.
Okay.
And then, then other than that, like what I focus more is on revision. Like even if you go on collecting more theory, the point is you tend to forget what you've read. So as much as you repeat the same things again and again, so I feel that was better. And after that, I solved the questions and subject-wise questions. Like I used to finish one subject, then solve that questions. And once I'm done with that, once I was done with all those, then I gave grand test. And after grand test, so once the score were above 60, above 70, I started.
Okay. How was your grand test score? I just...
Yeah, grand test score like above 60 only, 65, 70.
Okay, that's good. So you are just telling me, if we do an academically course with sincerity, follow the live classes, even though there's a time difference, our classes are scheduled in a way that you're able to attend from Australia as well, and just do the subject-wise mock, revise it properly, limit your content, you can easily clear.
Yes,
Right?
true. I think revision is the key. So whatever sources we're following, we should stick to it. And then definitely we have to focus a bit on recalls or the recent trend that is going on. And then we have to add on to our notes. So we should always see that our notes are like concise rather than broad. So that will help in revision, I feel.
That's a good advice.
Okay. And then whatever questions we are going through, even in questions, like if you made a mistake, like few questions are very easy, you don't have to go back to it. Certain questions will be confused in 2 options. So what I did is to make a note of those 2 options. What is the differentiating factor in that? So I think that will help.
I think that is one of the biggest doubts that students have, that there are a lot of questions. And I had a query where one of the students was like, these are J type of questions. Are there 2 correct options? Then I had to go and tell that student that no, there's always one correct option. The 2 look very similar, like you just said.
Yes, like in India when we practice, it was like we do both the things. Frankly, we do both things. But here it's like, what do you do first? So, or what you do later. So that's the little bit twist. The questions don't change much. Only like the topics don't change much, but only the way they ask the question changes.
That's a very great advice, Dr. Disha. So, as you mentioned, you were working in India. Did your clinical experience somewhere help in clearing this exam?
Definitely, it helped in clearing. But then I was exposed to only one subject, so the remaining subjects I had to refer here only. So that, but the thought process changes actually. Like I said, there you go with all the investigation.
Yes.
Here, so that was the catch. Like whenever we used to have recall sessions, also Priyanka ma'am and all used to discuss. Here, like the government pays for it, so you have to check on.
Like you have to limit the number of investigations that you're giving in Australia. Whereas in India, because it's private, it's all privately done. There is no centralized system like Western world. We do more tests. I think somewhere in India, we rely more on investigations rather than our own knowledge of medicine initially.
We do rely on our knowledge, but the patients demand investigations.
सारे कर दो डॉक्टर साहब, सारे टेस्ट कर दो. So, Dr. Disha, any advice for the students who are planning to take exam in this October and November month? Because we do have a huge chunk of students going for exam, especially with changing guidelines that has happened this year and the difficulty level and the pattern of question that has changed.
Okay, see, like I've already told you from the beginning how to do it, like revise and all. The last 2 months, what you have to do is, again, don't go for new topics, focus on the revision. And the last 3 months at least, if possible 6 months, if not at least the last 3 months, whatever recall topics have come, focus on those topics. And especially the options. You might feel maybe AMC has not given, maybe these recalls are wrong, but the two answers are very close. So you have to figure out what can be, how can it be twisted or how can it be changed. And last week, I prefer, like I could tell, like as ma'am, Sapnil ma'am and all used to tell, make the last week folder or the last day folder, focus on screening and the last, focus on the last day folder and recalls of that week. I think that would help. Even if not the same questions, the topics do come. So read those, like focus on the topics. Don't go to search new things, but whatever you've read, just analyze it. And yeah, pretty much be calm. That's it. I think once you're calm, yes, you have to be very calm in exam. Like we know the answer. It's just that you have to think, but what does Australia want from you?
Okay, one last question. What was your strategy? How did you attempt the question paper while you were in there? Like dividing the question and the time. How did you go about it?
Okay, again, individual, it matters. But then what I did was, we get a sheet of paper. So total 150 questions. I just wrote down 50, 50, 50. And people used to say, do the first 50 question in 60 minutes and all that. So I just wrote down the timing, like 60 minutes, next 120, 130 minutes and 210 minutes to finish this. But then I went quite slow in the beginning. I actually shouldn't have done that. But anyway. So after that, I realized that time was going quickly. So then I paced and yeah, I completed. I had to read some questions twice, but then I did catch up. Somewhere where I didn't know the answers, I was just marking and moving forward. So I didn't go to waste much time in that. Like I knew where my areas were. So and one more thing that helped was read the last line and the options. So that also helped. And questions were not that lengthy as given in e-medicine and all. It was fine. Like you just where the time went was in thinking between the two options, which could be correct. You easily roll out the two options, but the last two.
Okay. So, like you just mentioned, you have attempted e-medicine. I would like to hear reviews about it.
Okay, actually, I did not attempt e-medicine. What happened was I was aware of e-medicine in the last month. Like I booked my exam 1 month before. Okay. So around I think August, I booked my exam and September was my exam. And that's when I actually got to know about e-medicine. So the 210 questions that they had given, I did only those. And other than that, I did a few like maybe 50 or 100, that's it. Not much. So I don't have much idea, but I think e-medicine, as they are endorsing it, Yes. So if people do have time, they can do it up, other than academically tests. But academically tests were quite good enough for me.
Thank you.
Like,
So you would say if we just go through academically properly follow the guidance, it would be enough. We don't need to increase the resources, but instead limiting it and revising it again.
yes, theory no need to increase. If they do want, definitely one is academically just attempt all the tests and revise it again. The same questions, like at least go through it, what the answers are or about it. And second important thing I would like to say is handbook. Even though it's old, they were similar questions. At least 10 questions were similar. Maybe the options changed, but the questions were same as far as I remember. And third thing, like don't go for any other question bank. If you're going, then go for EPTC. Like if you have time.
That's a very great advice, Dr. Disha, and especially the considering that we have a lot of students sitting in October and November. The major chunk, as we all know, goes for October and November. So I hope they listen to this interview and follow your advice, limit their resources, and last 1 month goes to just revising and revising.
Yes.
Congratulations, Dr. Disha, once again, and thank you for joining us and taking out time for being with us.
Thank you, ma'am. Thank you very much.